Hello, this is Dr. Gay from First Look MRI, and these are 4 patients illustrating something you don't want to miss as a radiologist. It's very easy to miss, and it's a tear of the meniscus in a certain location. So a very common tear of the medial meniscus is in the very back where it attaches to the bone. It's called a radial tear, and they can be very easy to miss. I remember missing one at the beginning of my career. And since then, I've looked really carefully for them, and I'm amazed at how easy it is to jog past them if you're not looking for them. But this is a case where we see the back of the meniscus, the posterior horn right here, this dark band. This is the femur, femoral condyle, the tibia, tibial plateau, and this little black wedge, little triangle here is the medial meniscus. And this is called the meniscus body. Along the side, if we go towards the back, we see this dark band here, looks pretty good. We see this body here, looks good. And this is the anterior horn, hard to see. It looks good out here. It also comes across here, we can't see it that well, but this looks pretty good at first glance. And this is another view here, the medial meniscus body looking good, the posterior horn looking good. So very easy to just jog right past this subtle tear. So at the very back, there's a little white line here. This vertical band is a little white line. That is a tear where the meniscus attaches back here to the bone. It's called a meniscus root tear at the attachment. And I've seen many times this is passed over because it just looks pretty normal otherwise. This one stands out because there's reactive marrow edema. This brightness is some irritation of the bone, so it draws their attention to this area. But if the patient didn't have this edema, this would be very easy to miss. Probably more than 90% of people would jog right past that. And one more case here to show a normal meniscus root. So in this patient, they have an osteochondral defect of the femur. That's their problem, but their meniscus in the back here at least looks good. This is the meniscus going across, and the root comes down, attaches to the bone, but there's no bright line here. They did have a little subtle tear out here of the meniscus body. And now I'll show you 2 other tears. This is what happens later. As that root tears, as in this patient here, there's a gap will develop, and this meniscus squirts out. We call it pseudo extrusion of the meniscus. The meniscus no longer does its job of acting as a shock absorber, and we can get marrow changes. Our cartilage gets thinned. This patient has absent cartilage right here, and the meniscus gets pseudo extruded and tears. So this is a later finding, and also you get some brightness in the bone, the reactive marrow edema. And these can even go on to fractures. The bone becomes weak from too much stress and can fracture. And this is another case here where the bone is diffusely abnormal, probably related to the abnormal mechanics of stress. The bone can even go on to what we call osteonecrosis, where the bone will die and the articular surface can collapse. So these can be really difficult. Again, here's that meniscus body looking good. And in this other patient we see there's that tear of the meniscus root. We don't see it attaching here. So meniscus root tears are really easy to skip past unless you look for them carefully. And if you miss them, you could come back 3 months later and it could look just like this, where the meniscus is pseudo extruded a little bit and there's reactive marrow edema. So something to look out for.